Hi guys, welcome once again. Welcome back to my YouTube channel, the YouTube channel. And today we want to talk about a very interesting topic, something very peculiar, and I've had so many questions about this topic, about people wanting to know more. And I decided, you know what? Let me say something about it and let me put out a lot of explanation about it. The topic today is allergy. I think there's rarely anyone who doesn't have an allergy to something. People always react to something, but then it always depends on the severity. I mean, allergic reactions is just people reacting to normal things that other people might deem to be normal to them, but then some people react to it. So that's how our allergic reactions are. And when somebody is allergic, it doesn't mean the person has a poor immune system. It's important to know that an allergic reaction doesn't mean a poor immune system. But then, when an allergy goes on without being taken care of, it could cause some inflammation, which can now have an impact on the immune system in the long run. Also important to note is that one-time allergy does not mean that's the end of it. A one-time allergy, mild, moderate, or severe, can be a form of sensitization that when the person is re-exposed to that allergen, becomes something big. Allergies can even lead to death. It's very important. We're going to go through the different types of allergies that we have. As I always say, in many illnesses in medicine, it all starts from being mild to moderate to severe. Mild allergies, number one, they have very light symptoms. They can come from, they can be like the common allergies that we have from pollen, from pets, from dust, sometimes some mild food allergies. Some people take milk and they react. Some people see flowers, some people go near grass and they react. These are mild allergies, and the symptoms of mild allergies usually are sneezing, runny nose, sometimes there's itchy eyes, sometimes watery. Some people have what we call hives, some growths on their skin, some swellings on their skin that disappear, usually itchy. We call them hives, or medically we call them urticaria rash. Sometimes there could be mild swelling here or there in the body. Those are like mild symptoms of an allergy. If you have that, usually what we do is just use some anti-allergy drugs. There are some very common ones that people use. Just go through the anti-allergy drugs, just use them, and then they'll be fine. Sometimes people need to use anti-allergy, some corticosteroid cream. I've had to prescribe corticosteroid cream for a number of people, and also some anti-allergy drugs, very common ones. Sometimes when the skin swelling is a bit much, you can want to put some cold compress on it. But although I don't really advise the cold compress, because many people can even have access to cold to something cold that easily. Anyway, just ask them to just pop the anti-allergy tablet, and that just easy goes. The moderate one is a bit of course a bit worse than the other one, the mild, moderate, severe. In the moderate ones, it can be a bit more intense. It can be a bit more intense. Usually the moderate ones come from insect stings, and also some other food allergies, or drug allergies. The moderate ones can be from some people react to Fancida. Fancida can give you moderate reaction, can also give you a severe reaction, but not usually mild. Some people react to penicillins. Penicillins too can give you moderate and also mild. Insect stings, I've seen a lot of insect bites, and I've seen the allergies that come with it. Usually they come with swelling of the lips. Those people who have big lip swelling, sometimes it's of the eyes, sometimes of the whole face. We call it angioedema. In some people, these moderate symptoms can come with difficulty in breathing. It can look like asthma. It can look like slight asthma in some people, and can also cause some what we call bronchoconstriction. As the airway is tightened, the inner lining of the airway becomes smaller, and then those people have difficulty in breathing. Some people have nausea, some people have vomiting, some people have diarrhea, which could be through to some people who react to milk, some people who react to nuts. Who react to nuts, and also there could be some dizziness, and there could be some lightheadedness in mild to in moderate allergic reaction. So in managing moderate allergic reaction, now you remember that in the mild one, we said we apply topical corticosteroid, topical, the one you apply on the skin, but in moderate now you have to use oral corticosteroids because of the allergies that come to the throat area, the face area, because it's now a bit more, the way the body is reacting is a bit more than how it was reacting before. Now you have to give them something stronger. So some people even have to go as far as using insulin inhalers, inhalers. Some people go as far as using inhalers. Some people use what we call epinephrine injection. In Nigeria, we give them hydrocortisone injection. Some people have the preloaded epinephrine. There's something called epinephrine. It's an anti-allergy agent. It's already preloaded. Some people carry the pen all around. So when they just have the allergies, they just inject themselves in the muscular areas. And then, of course, after this, we need to allow some time for monitoring. If a patient walks in with swollen face, swollen lips, difficulty in breathing, maybe having used some drugs or taking nuts, or taking anything that patient has reacted to, a patient comes to the hospital, you want to give them this medication and also ask them to wait. You don't send them home immediately, just ask them to wait and just relax and then get back into it bit by bit. By the time you monitor for a few hours and see that they are getting better, then you are definitely free to discharge them to go home. Then the severe allergic reaction, the severe one is what we call the anaphylactic reaction. Anaphylaxis is life-threatening. It's life-threatening. I mean, that's why it's considered as being severe. And it requires immediate reaction. People who react to nuts, usually, as I said earlier, they have moderate to severe. These are the ones that come under this kind of reaction. I've seen people who eat nuts, and it was a case of a child who, when in her primary school, her seatmate was eating something, chocolates that has nuts, but she didn't know. Primary school girl went to ask for some, and her friend gave her, and immediately it entered her mouth. She started reacting immediately that she couldn't breathe at all. There was swelling all over, redness. She was itching the face, itching the throat. It was so bad. And she had to be taken to the hospital immediately, where she was treated. And for anaphylactic reactions, you have to admit the patient, because it's not something that will easily go away in a few hours, like moderate or mild allergies. For severe allergies, you have to really admit the patient. The symptoms it brings, as I said earlier, difficulty in breathing, swelling of the face, swelling of the mouth, the tongue usually is swollen, and it causes some level of airway obstruction. Because tongue is swollen, it blocks the throat, so air can't go in, air can't come out. In these people, there is what we call shock, because the blood pressure just comes down, and then when you check, their blood pressure is low. There's dizziness, there's some of them faint. Sometimes when you check their pulse is racing. They have widespread hives. So I mean, in severe, it's just like combining mild and moderate and multiplying it by 2 is usually very bad. People who have severe allergies usually very, very bad. Then how do we take care of it? For people who have the epinephrine pen with them, because in this part of the world, you see people who walk around with epinephrine pen, and it's in their bag, and they also carry a badge. So when they eat something and they're reacting, immediately, you search their body, you see the epinephrine pen, you inject them, or they themselves, they just inject themselves, and they inform the people around them that they've eaten something they're reacting to, so they know that the next thing to do is take them to the hospital. And of course, getting to the hospital, you have to give them IV fluid. First thing you want to ensure is make sure that this person is breathing fine. So you first put them on oxygen, put some IV fluids, and then you hospitalize them, vis-a-vis giving them the antihistamine injections and all the corticosteroid injections, over time, because as I said earlier, it really takes some time to get them together. And that's how important it is. There's another type, that is called delayed hypersensitivity reaction. Those ones are things that they don't happen immediately. It takes sometimes hours, sometimes days. You can also, I've seen it in one of my patients who reacted to a particular drug when he was a child, and when he came back to the hospital and they looked through his file and found out he reacted to that drug. The doctor was of the opinion that, okay, I think it's been a while, so let's try it again at a little dose. And they gave the guy the medication again, and all through the night, the boy did not react until the next morning. I mean, there was delayed hypersensitivity that happened in that child, and the guy broke down with some moderate hypersensitivity reaction, and the guy was treated. Of course, the symptoms are still the same. There's this swelling, there's this rash, there's a swelling rash, sometimes difficulty in breathing and all that. So, how do we manage these allergies generally? It's important to know that you can do some allergic skin testing to be able to show that, okay, what am I really reacting to? You can do some allergic skin testing. Some people use blood, some use skin snip, to check for the testing. Sometimes you can get some immunotherapy shots, something to make the immune system a bit stronger, so that when the person reacts, not like the person will not react, when the person reacts, it is not severe or moderate. It's usually probably just mild. So this injection just try to dampen the level of reaction your person will have to this stimulant. Also, lifestyle modification. I've had to tell some patients to remove the rug from their house because that rug is the source of the allergy. Sometimes you've seen patients who use air purifiers or humidifiers, as the case may be. Some people will have to tell them change the kind of soap you are using. And some patients, when they come to the hospital, they tell you straight up, doctor, I react to penicillin. So when we say react to penicillin, put it as if it comes up as a flash when you open this patient's case file. Or some of them say I react to fancida, or I react to sulfur-based drugs. So when they come to you and you open their file, it comes like a flash. So these are all preventive measures to let you to know, to let everybody know, and even the doctor know that there is a problem. And for people who have severe allergic reaction, it is important to always carry your EpiPen. EpiPen, that epinephrine pen is very important, so that by the time you have the aura, you are coming down with something, you quickly inject yourself. So it's going to be interesting to know what you react to and how you react to them. Put it down in the comment section. It's very interesting to know, and let's see how we can get you some help if I haven't been able to provide any help so far. Till I come your way again, I look forward to seeing you in the next video. Take care. God bless.